I'm going to do a quick demonstration on the insertion of the BD-Saf-T Intima, and that would be the subcut medications that are needed for patients for breakthrough and things like that. So firstly, points to consider are: you gather your equipment, you gain consent and explain the procedure to the patient. While you're doing that, you would inspect sites, and as you can see, these would be the sites we would advise. And wash your hands using the 7-step. Then, using your Clinell wipe, you would clean the site for 30 seconds. And while allowing that to dry, we could gather our equipment. So once you've opened your site, it's important that you rotate the safety shield 360 degrees, and after doing that you take this off and you check that the bevel is upright. And that the cannula has not covered the bevel before you insert into the patient. A wee tip is, before you insert into the patient, this shows you the wings up to the sky and the pebbles down to the beach. So pinch the wings quite firmly, and at a 45-degree angle, you insert into the patient's arm. While holding the wings, you pull firmly to release. So once the shield has fully separated, you discard immediately, and then you get your dressing just to hold this in place. Firmly down, so that's connected to the patient. We will now flush the needle. It's not possible to flush the needle, the cannula site at the beginning, because you have the safety shield in place. So I'm going to use the wee bung and give that a wee clean as well with your Clinell wipe. Always adhering to your aseptic non-touch technique. To flush this line, it takes 0.2 mils of sodium chloride, so it does. So I'm going to flush the wee bung slightly as well. So that's patent. And then you take off this wee bung. Be careful not to touch the key parts. You attach like so and flush with 0.2 of sodium chloride. You can see the line's patent. There should never be any blood in the line. If you find that there's blood in the line once you insert, please remove and go to another site. And as you can see, sites that to be avoided would be your lymphedema sites, already broken skin, areas with bony prominence, and tumour sites. A few points to consider. If you find that a patient is very thin and cachexic, you can insert the BD-Saf-T Intima at a 30 to 45 degree angle. Also, wee points as well, it's important to label the line. You date the line of insertion, the time and initial, and you can also, if need, write on the subcutaneous line PRN medication. As you can see. So for the administration of the medication, we would advise that you draw up the prescribed drugs and the prescribed flush of 0.2 mils of sodium chloride. You would cleanse the port with your alcohol wipe and allow it to dry for 30 seconds. You would then attach the Luer lock syringe containing the prescribed medication and administer the drug. Following that, you would go and flush the line with 0.2 mils of the sodium chloride. It's really important that you observe the site regularly for redness, swelling or pain, especially when you are administering the medication, and also making sure that there's no leakage. Record in your nursing notes daily, and it would be advised to keep the subcut line in for 5 to 7 days.